A major breakthrough in HIV prevention could significantly strengthen Uganda's efforts to reduce new infections following the introduction of Lenacapavir, a long-lasting injectable drug administered once every 6 months. Health experts, government officials, and civil society organizations, including HIPS Uganda, have welcomed the development. The new prevention option was discussed during a stakeholder workshop held in Kampala in collaboration with the Ministry of Health. The development comes at a time when Uganda continues to record thousands of new HIV infections annually, despite notable progress in reducing HIV prevalence from nearly 18% in the late 1980s and early 1990s to below 6% today. Research findings from the Makerere University Johns Hopkins University Research Collaboration Module indicate that Lenacapavir could play a critical role in strengthening HIV prevention efforts across the country. According to the lead researcher, Dr. Flavia Matovu-Chiwewa, the study was initiated in response to challenges many people face in consistently adhering to existing HIV prevention methods, highlighting the need for a more convenient and effective alternative.
It's called Lenacapavir. And why did we conduct this study? Because studies are very expensive. Already we have interventions that we can use to have one protect themselves against HIV. For example, oral PrEP. It's been available since 2017 in Uganda, and many people have been accessing it. And we have condoms, but why still do we need more interventions? So we see that with different interventions, people are struggling, especially condoms. People can't use them consistently. Taking a pill every day of oral PrEP is not practical. People in shared households having to remember the stigma associated with taking ARVs, because PrEP is ARVs. You're only taking it before you're exposed, but you don't get infected. So with that gap in adherence and people being able to keep on their interventions and being negative, stay negative.
Dr. Chiwewa says their findings demonstrated remarkable effectiveness, with clinical trials involving more than 5,000 adolescent girls and young women recording 100% protection against HIV infection. She adds that the intervention is currently being implemented in Mityana district and across 103 health facilities nationwide, with pregnant women among priority beneficiaries.
Results. The Food and Drug Administration, which is the overall body that looks at new drugs and authorizes them to come on the market, authorized Lenacapavir, and we now have Lenacapavir available in the facilities for people who are at risk of HIV. Because in Purpose 1, we also included pregnant women. When they would get pregnant, they would sign a separate informed consent form to allow us to give them product, and they take it when they're pregnant. We also have.
Meanwhile, the Ministry of Health says preparations for the introduction of Lenacapavir began in 2025. Although the injection is provided free of charge to eligible beneficiaries, individuals must undergo screening before enrollment. Access remains limited due to the currently available supply.
Covering about 104 health facilities. They are all over the country, mainly public health facilities, but also they are in PNFP facilities. The drug is free to those who actually need it, and when you actually go there, you will be tested, and for HIV first you have to be screened, and then you've been provided information on how actually to take care of yourself when you're taking this medicine. So then once you have actually met all the criteria to be able to be eligible for Lenacapavir, a person is then provided this Lenacapavir. We have limited doses because this being an innovator drug, the innovator drug means that somebody holds this patent. And when they do that, we have to work towards making generic options.
Uganda's HIV response has received global recognition for its success in reducing prevalence through a combination of behavior change campaigns, abstinence, condom use, HIV testing, and access to treatment services. However, health officials caution that Lenacapavir should complement rather than replace existing HIV prevention measures.
Look at a system approach where all these interventions are promoted as HIV prevention intervention in Uganda, rather than looking at the new intervention which is now Len. Because very soon, I think next year, we are going to get another intervention that will be one tablet taken orally per month, which is more convenient even for people who fear injections. Again, excitement will come up and people will shift to that one and leave the injection. So we want to avoid that and promote the combination of intervention.
Peter Mudiope emphasizes that the introduction of the injectable prevention option is intended to provide an additional layer of protection for people at risk of HIV infection and should not be interpreted as a license for risky sexual behavior.
Should not be worried about the new interventions as going to promote. If you've listened previously to Professor Serwada, that what has been there every time we get a new intervention on the market. When we got treatment, people were worried that once people recover their health, they will become promiscuous and start spreading the HIV. But that was not the case. That's why we encourage to have a very strong arm of
Health stakeholders are now calling for increased access to Lenacapavir, knowing that a wide availability could significantly accelerate Uganda's progress toward ending HIV, a public health threat, by 2030. Serena Naguja and Naomi Namsoke for NSTV.